Hello, welcome to the Dr. Milton Social Work Show. I'm Barbara Milton and I'm your host. Good to see you today. Um, we're still in the middle of the coronavirus pandemic, and it's still frightening, and I want to continue to talk about it. And I'm hopeful that people still continue to take it seriously. It's very good to have you here today. I appreciate you tuning in to my show. I'm a career social worker and I like to stay abreast of social issues and current issues. For social workers, everything matters. All the issues intersect when we talk about the general welfare of the public. And that's what this is. This is a crisis of general welfare of the public. So I want to do something different today. I mean, I spent a lot of time on, as you know, Twitter. I've done Twitter rants here before, and today what I'd like to do is go over some of the very interesting memes that I've received on Facebook. And there's quite a lot of them, so I think I'm just going to do like this one episode with it, but let's see how far we get. All right. So this very first picture, and again, and for the times that I can cite who gave it to me, I will certainly tell you their names. But there's a lot of people I just don't know who were the original creators of the memes, and for that I want to deeply apologize. I did not create any of these. These are not my works, but they're illustrative of some of the kinds of concerns that people are having with all different facets of this public health crisis. So let's start with the very first one. You can see, would you still go outside if you could see it? I mean, look at that. That's what it's like when we're walking around outside, right? This is what's in the air, potentially. If you're walking around without a mask, without protection, could you see how that might impact you? Would you be able to dodge these molecules? I mean, this is really the way it is out there. Um, would you still go out if you could see it? Right? So you're taking a walk, you're not 6 feet from the person in front of you or beside you, and that person's a carrier. Maybe you're a carrier. You have no mask. You're coughing. They cough. Droplets fill the air, just like this photograph. And the next thing you know, it's on you. And then the next thing you know, you're touching the part of you that has those molecules on it. And the next thing you know, you're putting your hands, your unwashed hands, in your eyes, near your nose, in your mouth. And there you have transmission. So there are things you can do along the way that the scientists and public health experts have told us about. They said, walk 6 feet minimally between you and another human being. That means in a 360-degree panoramic view of you. You should keep at minimally 6 feet between you and the other person. Secondly, we should be wearing masks. It's a no-brainer. And the right mask matters, which were the N95s. And of course, many of those are just reserved for the frontline workers. But they're saying any kind of covering can prevent you inhaling and getting directly transmitted and directly transmitting the coronavirus. So a bandana would work, turtleneck, the part of the turtleneck that's at your neck, that would work. Put it over your mouth and nose. All these beautiful handmade masks we're now seeing. People have really stepped up about that and creating masks for our citizenry. But cover your mouth and your nose and wash your hands, right? And I guess the intermediary step there is to be careful about how frequently you touch your hands to your face. I heard someone report today, it was a medical professional, who said on average, we touch our face 23 times a day. He might have said an hour. I think he said day though. That would really surprise me if we touched our face 23 times an hour. I don't know. I'm not that mindful of it. I guess it's a very subconscious and unconscious act. So the intermediary between mask wearing and hand washing is not to touch your face. And washing the hands and how critical that is. 20 seconds or more, hot water, not cold water, using soap. And the ideal is to lather up. And if you don't have soap, hand sanitizer works too. Just keep rubbing and rubbing until your hands are no longer wet. All right? And we do those things, we got a good shot at being able to mitigate the damage about being in an environment that looks like that. So think about that, you know? Um, Listen, I'm not going to die so this country can revive its economy. As an African American woman, been there, done it. My ancestors already did that, and your ancestors already did that. This country was built on the back of a lot of groups of people. Hardship. Some were chattel slaves like my ancestors. Others were indentured servants. Others were whole groups of people who were the overnight enemies of the country because we engaged in a war, for example, with Japan. So, so we have made sacrifices already for this economy. We've given blood, sweat, tears, and lives. But this is unnecessary. This is an unnecessary request from us, right? This push to, open up the country prematurely, I'm not for it. I'm really not for that. I don't think we should rush to open it up. I think it's a complicated matter. I, God knows, I can't understand the pressure our elected officials are under. All of our leaders at every level of local, state, and federal governments. These are tough decisions to make, and they're balancing the interests of many different kinds of stakeholders. We're just one of them, okay? So I understand it's complex, but I also understand that we have to use a calculus that doesn't cause more death than is inevitable. So, in other words, we can't say it's acceptable to kill 80,000, 100,000, 200,000 people. Why? Because car accidents kill that many people, the regular flu kills that many people, asthma kills that many people. I mean, look, when car seats and car accidents, when there were increased numbers of deaths in car accidents in the era before seatbelts, or babies dying in car accidents in the era of baby seats, our government made a national sweeping decision to mitigate that risk and made laws to require seatbelts and carriers for babies in cars. When AIDS was a pandemic, the federal government, after a period of time, after agitation by primarily the organization ACT UP and other advocates who are sick and tired of seeing their loved ones dying in the gay community and the Haitian community from HIV/AIDS, national federal guidance was given. A public campaign happened. Medication and science and the pharmaceuticals all came on board. And it took time to get through that crisis. And the vaccine was AZT was discovered. Behavior changes happened because of a national sustained campaign to target behavioral change, right? Then we mitigated the worst case scenarios with HIV and AIDS. We are doing the same thing. It's sort of a playbook for how we deal with this. Other administrations have dealt with it. I'm reading a really interesting book right now about the Spanish flu. Reading a book called The Great Influenza. It's about that pandemic in 1917 by John Barry. And it's describing for me very, in very, very much detail, uh, uh, sort of the origins of how we deal with bacterial and viral pandemics and how the medical um, industry had to change and adapt and become innovative to deal with this enormous crisis that killed, I think, 20 million people worldwide died from that Spanish flu. Staggering numbers while we were in the midst of a war. Um, and certainly one could argue it might have led to certainly the Great Depression that happened just 9 years or so later, or 10 years later. But yes, the economy is a factor. We have to think about the economy. I don't know about you, but I was so surprised when all of a sudden there were these trillions and trillions of dollars that was suddenly available to send out to bail out corporations, to assist small businesses, to give to the American citizens. I was surprised. I'm like, where did we get that money from? I mean, I just remembered a few short months ago these intense, entrenched, stalemated discussions about, I mean, relatively speaking, pennies, discussing about pennies coming into the coffers to help people. And now all of a sudden there's just trillions and trillions of dollars and more to be debated and discussed and more to come, I understand. So our government has the resources, apparently. It's just, where will the resources be allocated, right? What are the important components of the economy to continue to prop up? What is the strategy? Is the strategy to put money in the hands of the many and infuse money that way by people paying their credit cards and their mortgages and buying food and paying utility bills and doing those kinds of things, helping local merchants and small businesses? Or is it a top-down approach where all the support goes to major corporations who employ people and who can not go bankrupt during this time and continue to offer benefits and such like that to their employees? And that sustains them so they continue to get paychecks. I mean, it's a debate worth having about what strategy is the best strategy, and that's what we're witnessing in the news on a daily basis right now. Should every single state get relief? Is this a partisan matter? Is this a political matter in terms of politicization? I mean, does it matter if you live in a state that supported the current administration, a so-called red state, versus a state that might have gone blue, and that be the determining factor about what help you get and how much you get? I think there's something amoral about that. I also think on its face, it's a very false, it's a false analysis, because even in so-called red states, there are blue pockets. And we see that playing out in the state of Georgia, for example. Apparently it's a very, loyal Trump supporter who's the governor of Georgia. And then there's Atlanta, who has an African American woman as the mayor, and it tends to be more democratic. And they're at war, like between I guess they're not at war anymore. I shouldn't say that. Initially, certainly they disagree with approach. I guess we could say that. There's some things they have common ground on and they're working around, and there's others, there's big gaps of disagreement. So, but should this be a partisan matter? I think not. And that concerns me that we are in that situation right now. But the most important thing I'm trying to say here is that we don't need to die. It is a false choice that it's either us dying or my grandmom dying. Well, God rest her soul, she's already gone. But your grandmom, if she's still around with you, God bless you. But her life shouldn't be held in the balance for the sake of companies. That's my point of view. You may think differently. I'm curious to hear what you think, actually, as I touch my face with my hands. Shoot me an email at drmiltonlcsw@gmail.com. Tell me what you think about this. Is this a false choice? Should we be pitting sick and vulnerable, poor people, the homeless, people in prisons, pitting their lives against jump-starting an economy again that is dependent on certainly a workforce, obviously? Um, uh, is that a good trade-off? Now, I think we open up jobs under a couple of conditions. One is everybody gets tested. Because if you don't know who's sick and carrying coronavirus, how can we protect ourselves from it? Now, if you're in a meat processing plant and you're standing inches next to another person, isn't there a responsibility on the part of that corporation, of that company, to do something to safeguard your life so that we can continue to get the goods you're producing? And trust me, I want beef like the next person wants beef, right? And I want the goods as much as the next person wants the goods. But we have to do it humanely. And I think that that means testing. I think it means creating ways to put barriers up between people so that they're, if you can't do 6 feet, which is the guidance mandate, have a barrier between you and the next person, right? And you should have protective equipment, gloves, mask, facial shields, right? And if you're going to do your job in the interest of all of us, then you should be protected. It is not um, acceptable to put your life on the line to bring goods to us. That's just how I feel about it. Now, ask yourself how you feel about it. Let me know what you think. Send me an email. All right? So that one got me when I saw that. It's quite a lot to say about it, probably more than I thought I would say about it. um, I guess, you know, the bottom line is this. A mask is better than a ventilator. Home is better than an ICU. Prevention is better than a cure. It's not a curfew, it's a care for you. You don't want to wear a mask? I hear you. You feel like it's impinging on your freedom? I hear that too. Do you think that's an impingement on freedom? Shoot me an email and let me know what you think. But God knows I'd rather wear that mask today than to be on a ventilator tomorrow. I'd rather social distance, follow the curfews, stay home, than be in an ICU where, the hospital's the last place I really want to be. Um, Obviously, prevention's better than the cure. I was hearing this statement a few times, and it really bothered me when I heard the president say it, and he said, well, the cure can't be more expensive than the problem, or something like that. And I was like, what does that mean? And again, it was economy was what he was talking about, I think. Like, better to have people die than to tank the economy? I don't know. But I've always been a firm believer that prevention is better than the cure. A cure is going to come. It will come. I have faith in the science. I have faith in all the scientists working on this, and it will come. And in the meanwhile, we got to do the right things to prevent ourselves from getting sick, right? And we're all in this together. God knows this is what this pandemic has taught us. I wear the mask not for me, but I wear it for you. I wear it for my grandmoms, the sick, the children. That's who I wear the mask for. And let me tell you something, for people to say that protesting these rights around wearing masks and social distancing and washing your hands and the curfews and all these sort of things, that these are like Rosa Parks. God, I was so insulted when I heard that. Do you think this is a Rosa Parks moment for these gun-toting, angry, defiant, gun-carrying white supremacists? That's one strain of it. But a lot of them are just other people who've just, in my view, gotten very, been the victims of a lot of disinformation. Shame on Fox News, shame on Sean Hannity, shame on Rush Limbaugh, shame on Alex Jones. I mean, this guy the other day said he was ready to turn into a cannibal. Let that register with you. He said, I would eat my neighbor if it came down to it. If we didn't have no food, I guess his line of reasoning is like, you can't force me to stay home. You can't force me to wear a mask. And if everybody's dropping dead around me, and aren't enough people in the meat processing plants and in the Walmarts, in the stores where I go to get goods, and if there's nothing around, hey, I'm ready to survive. And survival means I'm going to eat my neighbors if I have to, because I've got the AK-47 long gun, and it's by any means necessary, they're going to survive. That is such a scary thing. Very scary, right? We're talking about, I'm insulted that you would compare your arrogant, selfish, myopic, testosterone fueled, faux Second Amendment right libertarianism and compare that to Rosa Parks, a civil rights icon for a group of historically oppressed people, of people who came out of chattel slavery. Don't know what that means. Who is fighting for accommodations, to ride buses and to eat in establishments and stay at hotels. All the rights and privileges that you have, Mr. White Man with a gun in Michigan and Texas and Florida and Toms River, New Jersey, and other places. How dare you equate this to a national icon and hero like Rosa Parks? God, did that infuriate me when I saw that. And then what's up with all these German placards with these swastikas, and where's all the anger coming from? I don't understand it. I don't understand it. But certainly it's been here a long time. I mean, I understand the anger of the white man. I'm not meaning to say that. I just don't understand how they don't get that gun and that camouflage suit is not going to prevent them from getting COVID-19, transmitting it to their loved ones, their wives, their children, their grandparents, their great-grandparents. Is it worth dying for? Maybe they think it is. I mean, God knows, maybe that's the thing that's similar to Rosa Parks. I mean, they're willing to die for their cause. And, I don't think any civil rights icon wanted to die for the cause of equality and justice, but many did. And many resolved themselves to the fact it was very likely because the strings of power were not in the hands of black people. I mean, remember Schwerner, Goodman, and Cheney? Remember Emmett Till? Remember all the lynchings? That's about who's in power. That's about systems of oppression. That does not exist for white men in America. I know they think so. What do you think? That's my thinking about it. And, as in the case of Atlanta, Georgia, between Governor Kemp and the mayor of Atlanta, perhaps we agree to disagree about what oppression is, who's oppressed, how oppression shows up in this country. We can agree to disagree on that. But why you need the guns? Why you need the swastikas? Why is that necessary? Why do you need the Confederate flags? And I thought this was interesting too. And I don't have a picture of this. There's a picture of a guy holding a sign that said, "Hands off my body." That freaked me out. Why? Because that's a sign women have been carrying for a long time in this country. Hands off our bodies. Why is it good for men? Why is it being validated and legitimated for men? Why do men fail to have the empathy and the compassion for women who have been saying this for years? Reproductive freedom, sexual harassment, sexual assault. Hands off our body. Let us control our lives. I find that very interesting. So I only went through a few of these today. I knew I wouldn't get through all of them. I'm going to do this again because it does allow me to have sort of starting points for how I want to talk about this pandemic on my show. And I guess the last one I want to really point out is that a big thank you. Big thank you. All the people on the front lines, the social workers, the medical workers, civil service employees, first responders, journalists, factory workers, truckers, pardon me, grocery workers, utility workers, everyone who's working to keep things going in these trying times. Thank you so much. The mail carriers, the utility workers, banks, the sanitary workers. My God, so many people. They deserve our thanks. They deserve our thanks. And in the words of the mayor of the city I live in, we have to always hold out for hope. I place hope in the scientists, public health professionals, the doctors, the stories of neighbors helping neighbors, the way families have bound together and are doing the right thing, the innovation that's come to the forefront that allows us to stay connected, like Zoom and other platforms. We have every reason in the world to still remain hopeful. We're going to get through this. This too shall pass. I'm going to wrap this episode up with something my grandma used to say. She used to say, if God brings you to it, God's going to bring you through it. And I'm going to put my hope there. Thank you so much for watching today. I'm Barbara Milton, career social worker, now retired. I'm delighted to be here sharing a little good news too. And I hope you learned something. And I wish you well, stay safe. God bless.